and I know you've done several studies, clinical studies. I want to talk about one of them. You did a 6-month controlled study where share a little bit more about how that study worked and some of the outcomes that you saw from it.
Yeah, it's just going to press, so I don't want to give away all our. Well, part of it is also one of the researchers, Ryan Dickerson. It's part of his research for his PhD thesis. So I don't want to say too much about that, but I can tell you, first we found. I mean, we had a number of different questions. So this is a 12-week intervention for women with metastatic breast cancer. So it's stage 4 metastatic breast cancer. Essentially, the medical community has done all they can for these women, and so they're very ill, and so because they don't want the ketogenic diet to be confusing any other experimental drugs or whatever, that's the patient population we work with. So they're very motivated, but we put them on a ketogenic diet, and we've had great success with them staying on it. They are now. I should some of the caveats. It's not a homogeneous group. There are different types of breast cancer, and there's single, double, triple positive. They're on different medications, the standard of care, usually Xeloda or Taxol, aromatase inhibitors, those sorts of things. So they are on drugs, and we then provide this intervention. And what we've seen over so we do initial blood draws, and we do initial imaging. So it's the first clinical use of a PET CT scan. So we're imaging the tumor mass itself. We're doing blood draws. We're doing daily draws of blood, finger prick for ketones to make sure they're in ketosis. We feed them all of the food. We provide the food for them. So we know exactly what they're eating. So we know what the composition of that diet is. And so what we're seeing after 6 weeks, we do more of the measurements plus DEXA. So we know the body fat composition. Then we do it again. They go free living after that. So they learn how to cook for themselves, make meals and all that. And then we measure them again at 12 weeks. And so this, I would have to say, anecdotally speaking, we see significant improvements. First of all, there were no adverse effects. So none of the women in the study had any adverse effects that were related to the ketogenic diet. So first, do no harm, right? We wanted to be sure that was the case. Secondly, and perhaps most profoundly that we can say, is the ketogenic diet had the same effect on these women as it does in a normal, healthy population. So a very positive effect in terms of body composition and blood glucose and insulin levels and insulin resistance. All those things change for the positive. And so they're in better health. Yeah. So, and so one would presume that would mean you would have a healthier immune system and immune function, and perhaps that would help to reduce tumor mass. We did see reduction in tumor masses and tumor markers throughout the study. And it was pretty consistent, not everyone, not all the time. And again, they're different types of cancer with different cell types and so on. But so I would say this is emerging science, and that it indicates that there is very positive therapeutic benefit to a well-formulated ketogenic diet as a concomitant treatment. In other words, along with the standard of care. So there are no studies, although there are anecdotal things out there on the internet. Sometimes tumors spontaneously resolve. So you have cancer, it's going to kill you, and all of a sudden it's gone. That's probably it's almost surely your immune system is suddenly becoming activated to that. We have other clinical studies that show that there is an increase in the positive immune effects, anti-cancer, anti-tumor immune effects. In a previous study, we also saw that in this study. So some of there's called cytokines and chemokines. These are kind of like cell communications for white cells and other elements of your innate immune system. We're seeing an upregulation of the ones that are anti-tumor. So there may be a mechanism by which those tumors are reduced. And the patient study is only 13, so it's very small. Yeah. But one woman just cancer went away. So was that the diet? I don't know. It didn't hurt. She's certainly better. And we don't follow them up after the 12 weeks. That's part of the ethics thing. So we don't know what happened after that. But yeah, imagine that, where you're told to go home and get your affairs in order, and 6 weeks, and this is 6 weeks later, the tumors are all gone.
It's amazing.
Yeah, and as I say, the medical community giving up. So yeah, I do get lots of emails and stuff from people. I'm happy to address them when I can, but I do want to emphasize again, you need to do this. If you're going to do this, you need to talk to your physician about it. It might be contraindicated for reasons I also mentioned in the book. and you need to tell your oncologist this is what you're doing. I think I think it will start. It is being used in more and more places as a concomitant treatment for cancer. But again, going back to the top of our discussion, it's a really good way to prevent it. Excuse me. Although,
and that's the key, prevention. That's what we want to do. A lot of people listening are probably listening and watching for prevention, so it's perfect.